so. Thank you very much. So we go ahead and remove a little bit of Vaseline from our pot. Then we can go ahead and take the Q-tip. And because I am doing a peel, I'm going to go ahead and put a little bit on her lips. Because we want to remind ourselves that we are not going to put peel on the lip. I'm going to put a little bit around the nose. Not a lot. They don't want to feel like they lubed up. Okay? And then I'm going to go ahead. I've thrown that one away because you don't want to go from the nose to the eyes. This is not nice. Okay? Go ahead and put one on that little spot there. And then I'm just going to go ahead and put a little bit around the eyes, just like an eyeliner. And look up for me, please. And just a little bit under the eye. The reason why I do this is that if they do tear up, it'll help just block that. It's also a really good reminder that we only do our peels and our microdermabrasion around the orbital area, not above the bone. Okay. She told me in her consultation that she does not have any tattoos on her face because I'd want to avoid that area. Okay, the tattoos on the brows tend to fade a lot over time. They still have to have them touched up. So that's an important step to remember. I'm going to go ahead. I have one loopy gauze cut into a 2x2. This is loopy gauze. Okay, I'm going to go ahead and saturate my gauze with my glycolic acid with 35% glycolic acid with green tea extract. This peel is perfect as an introductory peel, as well as it is fine for Fitzpatrick scale 1 through 6. Okay, so like a toner, I'm just going to go ahead and wipe the skin. I can include the neck because this is a spa grade peel with a pH of about 3. So I'm going to go ahead and could you fold your lip in, please? You want to make sure you don't get on the lip, but getting it on the upper lip is important. Make sure you own the nose. And I'm going to make sure that I do not get it on that area where she performed slight surgery. Okay, just looking if there's any spots that I felt that I missed. And then I'm going to go ahead and wait 5 minutes. This peel is a spa grade peel and can be on the skin for 5 minutes. I'm going to ask my client 1 to 10, 1 being the least, 10 being the most in discomfort. I'm going to explain to the client that glycolic acid feels like spiders on the face. There may or may not be some tingling, and that is quite normal. You must always psychologically prepare your client for what they're about to experience. So 1 to 10, 1 being the least, 10 being the most. Where is the sensation that you're feeling?
Just at a 1.
At a 1, so you're feeling kind of tingling? Okay. Glycolic acid is an alpha hydroxy acid. It is water soluble, and it dissolves the glue that holds the cells together. It is great for brightening, for building collagen and elastin. It also has a nice tightening effect on the skin, and it's also good for hyperpigmentation, and it's good for acne, so it's really a good overall great peel. It is derived from sugar. It is the gold standard. Glycolic is the gold standard. The green tea extract adds some anti-inflammatory abilities to it, so it's great for a more sensitive skin. Okay, so she has 4 more minutes. What number are you up to?
At a 1. Still at a 1.
It's a stable at a 1.
Yep.
Okay. We find peels have a habit of starting to climb, and then they will stop at their end point. They will kind of stay, and then the skin will start to neutralize it, because if this is a pH of 3, her skin is a pH of 4.5 to 5.5, okay? So it's below the skin, so that means it's doing what it's supposed to be doing, and the skin is going to start working it through. That's why it's going to level off, and then it may not drop down. When I put water on the peel, water has a habit of reactivating the peel. Okay, so she will see a little bit of an increase of sensation. That's why it takes 30 seconds to apply a peel, but it can take up to 5-10 minutes to remove a peel, because we want them to be at a sensation of 0, of nothing. So we're going to have to keep neutralizing. I have a bowl of cool water. Okay, never ice directly on the face. You can put 1 or 2 blocks of ice in the water if you wish to. And we've put a teaspoon of baking soda, because baking soda has a pH of 9. It is more alkaline. So that also helps neutralize the peel very effectively. But remember, water is a pH of 7. So that's going to neutralize the peel anyway. You can push that back more. You look like you're peeking through them. Okay, we have 3 more minutes. What number are you at?
Number 1.
Number 1. I'm going to go ahead and check.
A very tingly one.
Just a tingly one.
Yeah.
Okay,
It's
okay, I
running
am
all
looking
over
at
my
her
face.
skin. What do you think I'm looking for on her skin? Looking for any type of erythema or redness. Remember, the end point for AHAs is erythema or redness, so kind of like a pinkness to the skin. But what I would be concerned with is some sort of hot spots, which would be like a type of histamine reaction, okay? And then I would remove that area. Okay, so my end point with a beta-hydroxy acid or a salicylic acid would be frosting or the coagulation of protein in the skin. Okay, so we have another 2 more minutes. The only thing you're doing while the peel is on is you're standing here and you're watching your tissue response. You're not massaging the hands or the feet or the décolleté. You never leave the room when equipment is turned on, the steamer is on, or peels on the face. Or, what else do we never leave the room with? Tint on the lashes. That is a huge no-no. And I have seen it before. Because they can rub their eye and the tint can be in the eye. Okay, so you want to make sure that you stay. I'm staying with her for the entire time, and you're just going to be chatting to her about her comfort level. You can have this is a very mild peel, but if you do a more aggressive peel, I always have a fan present for them to hold, which basically makes them interact with the service, gives them some comfort, and the fan takes a huge bite out of it. Okay, so now it's time to neutralize the peel. I have a bowl of cool water and with a teaspoon of baking soda. Okay, what I like to do with glycolic is I like to use my sponges, clean sponges, and what I do is I start to just basically do cool compresses, and her skin looks very pretty. And I also checked with her because after this peel I'm going to go into the microdermabrasion. So I checked in with her and she did not indeed wear contact lenses. If she's wearing contact lenses, she must remove her contact lenses before the procedure. We have contact lens solution and little dishes for contact lenses at the front desk. We do not want to skip any procedure because we do not wish for them to have crystals in the eye. It can happen by mistake. We avoid the eye area, but you know, sometimes a machine can dump crystals. You don't know, and you want to make sure that the front desk here does tell them that if they are having a microdermabrasion procedure, that they should please bring their contact lenses containers. But we have spare here at the front desk just in case. Right, I check in with my client because I have added water to the procedure, and I ask her, how is your skin doing?
It's leveling out.
It's leveling out, but you can still feel.
Yes.
Okay. So we're going to carry on. Okay. Is there a particular area?
Yep. Down on my mandible area.
Okay. Very good. Because I don't know what's going on unless I ask her, unless I communicate with her. So I'm going to go ahead and just hold this. Are there any questions so far? Because once I've neutralized, when the client says they're at a 0, I just do one more neutralizing of the peel. The reason for this is that clients get so bored with this that they say, oh, it's fine now, it's fine now. Well, you know, we want to make sure that we've done the right thing, so I always neutralize one more time, even though they say they're at a 0. Okay, where are you at now? Is it still around the chin area?
Yep, I'm at a 0 except for like just a spot right here.
Okay.
And then on my upper lip.
Okay, very good. So by communicating, I know what's going on because her skin looks fine, but you know, and also sometimes they start feeling itchy around the ear or their hand. It's just a weird thing with the brain.
Towels.
Okay, then I'm going to go ahead and dry her skin, and then we're going to start with the microdermabrasion. Now, she's had microdermabrasion before, and you usually set your machine for your microdermabrasion 30, 35?
I do usually like 25, 30.
Okay, so she's had microdermabrasion before, and on her chart it will say that the machine is set for 25-30, but I always do a tactile test, okay? And I'm going to turn it down for around the eye area. And then, okay, so we're still a little itchy on the sides?
Yep, only on my right side.
Only on the right side, okay.
That's it.
And that's it. Okay, very good. So I'm going to go ahead and dry the skin now, and I'm going to do 2 passes, one way or another. I'm going to get you. I'm going to find you. Right? 2 passes, slightly overlapping. How do we know where we've been? Erythema and crystals. Okay, on an ethnic skin, it's very difficult to see erythema, so you're going to look for definitely the crystals, okay, and the client comfort. Okay. Excuse me?
I'm pretty much at a 0 now.
Okay, she's bored, so we're just going to do it again. Okay, I'm going to go ahead and dry the skin again. Remember the moisture on the skin. So this has really prepared the microdermabrasion, and this is going to make it a much deeper peel. So I'm going to do 2 passes with my microdermabrasion. I'll do my tactile test first, and I'm going to avoid the area where she performed surgery. Okay, I'm going to go ahead and turn my machine on. I'm going to occlude it, check my crystals.